without all this stuff on it. So it's going to be seeming really strange when we get this out today.
Mm-hmm. So is that stronger stuff than you used last time when you numbed it? Because last time you had to like poke it several times in several places. And
It's a short and a long-acting local anesthetic. It's Marcaine and lidocaine. So I'm trying to think what we used last time. I think last time I just we'll see how you do with this, if I need to poke it again or not. But I think last time I ended up going all the way down and all the way down. But if we can get the nerve root up in here, it'll numb, pretty much everything. I don't know how painful this is really going to be for you, because those pins over time they kind of loosen up a little bit, and like I say, you'll feel the pressure regardless of how numb it is. And a lot of times we don't even numb these up; we just back those pins out, and that's it. So we'll see how you do though. All right. Does it feel kind of funny at all?
yeah.
Yeah. All right. Want to see if we can give it a try? Yeah. All right. Let's go. See how you do. All right. Doing okay? Okay?
Yep.
Yeah, good.
Do I get to keep the screws?
If you want them,
Okay.
we can put them in a little bag for you. There's one.
Am I only your only sadistic one patient who's always like, here, can I have this? Can I have
No,
that?
actually, a lot of people want them. Yeah, especially things like screws, the pins and things that we use for K wires. A lot of people don't care about, but some of these more substantial kinds of hardware and things people like. Plus, somebody like you who's been in your foot for 4+ months, so kind of grown attached to it.
Yeah. Literally, you might find some bone in there.
Yeah, exactly. Now you're done with your antibiotics. You're not on antibiotics right now, are you?
No, I'm not.
Okay.
I took them for that short time when I went to the dentist, and
If we've got some, might be worth a little stitch on some of these. We'll see. When I get it out of here, sometimes I'll just throw one little stitch to kind of help those close up a little quicker. You all right? That hurt?
no, I heard stitch. And
Oh, okay. We don't have to. You don't want to, though.
okay, that stings a bit.
Is it? That's actually a good sign, because that's one of the pins that was in the graft. Normally, people don't feel those at all. If that graft was dead bone, we put it in there. You got pain medication if you need it.
Do we, Doug?
Got a little.
Okay. You get you a prescription for what were you taking before? It's been so long since I wrote anything for you. I gotta go back and look. Is it Vicodin or Percocet? It's Vicodin.
Vicodin.
Give you some Vicodin and
Good.
give you some Augmentin just to be on the safe side.
Oh,
These are healing. All right.
stung at the end.
Did it?
Yeah.
Coming right through the skin.
Yeah. It's got it coming through the skin. See how these two do. Down to 2. Doing real well. Stability's still good. Oh, this one's loose. This should come right out. This is the one I thought would be the loosest anyway, because it's in that little tiny fragment. You all right?
One to go.
about done. Just about done. Bear with me for just a minute here. All right. That's it.
Is that it?
Yeah.